Maayong adlaw, mga kadabsranon. Karon duna kitay duha ka opisyal nga video report. Gikan sa Provincial Government of Davao del Sur. Ang unang report sa opisina sa Health Office sa probinsya. Diin kipatigayon kagahapong adlaw August 17, 2026. Ang ikaduha, ang opisyal nga report sa tibuok pondo sa probinsya para sa 2026. Atong tanawon, nagkatugma ba ang ilang gisulti? O kung doon na may dakong kalahian, kinahanglan natong masabtan.
Maanyag na kabuntagon ka natong tanaw. The Provincial Health Office of Davao del Sur has been actively working to translate universal healthcare from policy into practice by strengthening local health systems and ensuring that services are accessible. By focusing on preventive care, capacity building for health workers, and community-based health programs, the office is turning the vision of UHC into tangible improvements in everyday healthcare delivery. Efforts highlight the importance of local leadership in making health policies truly responsive to the needs of the people. Our vision, an integrated and comprehensive province-wide health system approach, ensuring health literacy, healthy living, and protection from hazard and risks without causing financial hardships. Our mission, to provide equitable, affordable, quality, and readily available health services that is suitable to the needs of Davao. The Office of the Provincial Health Officer serves as the central authority for provincial health governance, integrating public health programs and hospital operations under a unified leadership structure. At its core is the Dr. Felipe de la Peña of Gregorio Matas District Hospital, who bridges coordination between hospital divisions to maintain operational efficiency and service quality. The Administrative Division manages the core support systems of the agency. It handles personnel management, budget allocation, asset procurement, record keeping, and general facility operations to ensure that public health programs and medical staff can run smoothly. The Technical Division implements public health programs, supervises field health services, and coordinates disease prevention, maternal and child care, nutrition, and environmental sanitation initiatives across municipalities, city, and rural health units. We implement advocacy campaigns and health education programs promoting preventive care. We also monitor disease trends, collect data, and coordinate outbreak responses. Furthermore, we develop emergency preparedness plans and coordinate health responses during disasters. Most importantly, we provide technical assistance, oversee planning, implementation, monitoring, and evaluation of provincial health programs. The Supply and Procurement Division manages the acquisition, storage, inventory, allocation, and distribution of medicines, vaccines, medical, dental, laboratory equipment, and office logistics for augmentation of public health facilities, provincial and district hospital. Our Medical Outreach Division conducts medical missions and mobile health services. We bring essential equitable healthcare directly to remote, unserved, and underserved or vulnerable communities. We plan, coordinate, and deploy mobile medical teams to bridge gaps in regular local health systems by delivering basic medical, dental, surgical, and optometric screenings, consultations, and minor treatments directly to barangay and remote sites, prioritizing geographically isolated and disadvantaged areas and marginalized sectors. We have 42 regular employees, 1 doctor, 2 dentists, 13 contract of service, and 40 job orders. we have an approved budget for calendar year 2026 in the amount of 163,205,909 pesos and a total amount of 56,737,235 pesos for 24 major public health programs. We have 21 programs and with funding sourced from the Local Government Development Fund, which includes the following: medical outreach program, family health programs, communicable diseases and prevention program, non-communicable diseases and prevention program, environmental and occupational health, support to mental health, and the programs under the Universal Healthcare Province-wide local health systems. We have 3 programs with funding from other purpose, namely support to Provincial Health Board, which is conducted monthly, support to 300 barangay nutrition scholars, and support to 2,890 barangay health workers. As an integration site, we have received cash grants from the Department of Health, both for fixed tranche and financial grant amounting to 2,611,447 pesos, which are primarily used for support to health investment planning, population-based services, and local health systems development. The office has filed 220 leave forms and prepared 127 payrolls. True to its mandate, we have conducted various committee and consultative meetings, lectures, inspections, program implementation review, conducted regular monthly provincial health board meetings, and other meetings as required and applicable, as well as pre-assessment, monitoring, and evaluation activities. Different trainings, workshops, and seminars were being conducted and facilitated as technical assistance to all municipalities and the city. We were able to update and test our disaster risk reduction and management in health plan, facilitated the nutrition program management plan, and the formulation of the nutrition action plans down to the barangay level. Follow-through workshops for local investment plan for health and annual operation plans for 2027 were done. We have conducted, facilitated, and assisted different trainings and capacity building activities. Surveillance, monitoring, and evaluation activities province-wide, including psychiatric consultations and psychosocial support sessions. The Zero Open Defecation Validation is a formal inspection process used to check and certify that a community. We have received donations from the Department of Health and allocated a total of 50,619 different vaccine vials to all rural health units for the implementation of our population-based services. While the provincial government of Davao del Sur has procured the needed drugs and medicines of the different key programs for augmentation and allocation to all municipalities and city with a total amount of 15,211,496 pesos and 20 centavos. While 2,540,240 pesos and 75 centavos were allocated for the procurement of medical, dental, and laboratory supplies. An initiative of the provincial and reaching far-flung areas to deliver free consultations, checkups, dental, diagnostic services, surgical procedures, optometric and ophthalmologic consultations, as well as provision of reading glasses and medicines directly to underserved communities. A total of 10,260 patients were able to avail these free services offered from the period of February to June of 2026. In partnership with the Provincial Veterinary Office, they have provided veterinary services to 2,242 animals, with 43 barangays being served province-wide during the same period covered by our dedicated medical outreach team. The Provincial Health Office of Davao del Sur and its health programs have earned notable recognitions and awards from the Department of Health and regional bodies of the National Nutrition Council, as well as individual leadership honors for sustaining exemplary public health initiatives and practices. The year 2026 stands as a testament to our steadfast commitment, collective resilience, and unwavering dedication to the health and well-being of every Davsuranon. Guided by our mandate to protect and uplift our communities, we continue to strengthen its structures, expand essential services, and uphold the principles of equity, quality, and accountability. Throughout the year, we continue to intensify the implementation of priority health programs, enhance the capabilities of our facilities, and deepen intersectoral collaboration. We likewise advance systems development, fortifying leadership and governance, optimizing human resource deployment, strengthening health financing mechanisms, and expanding digital health initiatives to support evidence-based decision-making. Together, these accomplishments affirm our shared vision of a responsive, resilient, and people-centered health system. Even as we continue to face challenges from resource limitations to emerging health threats, we remain resolute in our pursuit of continuous improvement. The lessons over the past years will guide us as we refine our strategies, embrace innovation, and strengthen partnerships to ensure that no community is left behind. We extend our profound gratitude to our municipal and city health officers.
Kana, ang opisyal nga report. Nindot paminawon. Daghang programa, daghang nahimo. Daghang plano para sa katawahan. Pero, taliwala sa maong report. Adunay usa ka linya nga kinahanglan natong huna-hunaon pag-ayo. Niingan sila.
We have 42 regular employees, 1 doctor, 2 dentists, 13 contract of service, and 40 job orders.
Usa ra ang doktor. Duha ka dentista, apan 95 ka tao ang admin. Kontrata og GO na nagtrabaho sa opisina. Usa ra ka doktor, alang sa tibuok probinsya, alang sa gatusan ka libo kalumulupyo sa Davao del Sur. Kini ang atong pamutana ug atong dugangan pa sa ikaduhang video.
Nga niagi og nisubay sa taas, kuti, husto og legal nga proseso sa pagprepara og paghanay sa annual budget. Ang annual budget para sa tuig 2026 sa katidad ng kapin 2.5 billion pesos kay natunga sa upat ka expense class. 49.41% sa budget kay gitagana para sa maintenance and other operating expenses o MOOE. 30.40% pod niini kay para sa personal services, 18% para sa capital outlay ug 2.19% para sa loan amortization. Nabahin po ng expenditure program sumala sa sektor. Nakaangkon og pinakadako nga bahin ang economic services sector nga adunay 27.64% o kapin 692 million pesos nga bahin. Diin naglangkob niini ang critical areas sama sa infrastructure, agriculture, environment, investment, and tourism. Nisunod ang general public services sector nga nakaangkon og bahin nga 27.50% o kapin 688 million pesos. Ug ang ikatulo kay ang health services nga mikabat og 557 million pesos o 22.27%. Sa isa sa pinakauna sa gitagaan og dakong pagtagad sa probinsya ang health programs aron masiguro ang paghatag og maanyag health services ngadto sa pamilyang Davsuranon. Sa tuig 2026, 22.27% sa kinatibuk ang budget o kapin 557.8 million ang gitagana para sa health. Kapin 499.7 million pesos ang gipundo para sa operations sa PHO, DSPH ug GMDH. Lakip niini ang sweldo sa mga personahe sa ospital, pampalit og tambal ug uban pa. Miabot sa 121 million 176,777 pesos o 32.01% ang increase sa budget alang sa operasyon sa DSPH, PHO o GMDH ko itandi sa niaging tuig 2025. Kini nga pundo uban sa pagpatuman sa expansion sa DSPH o pagpalit og mga modernong medical equipment alang sa atong ospital. Makasiguro kita nga ang atong mga ospital nga gidumala sa probinsya magpadayon sa paghata og mas paspas, mas maayo ug di kalidad nga serbisyong medikal alang ngadto sa pamilyang dabsuranon. Dungag pa niini 58 million usab ang gitagana para sa mga public health programs nasama sa medical outreach program, sponsored PhilHealth program, nutrition program ug uban pa. Usa sa
Og kana ang opisyal nga budget report. Atong hisgutan ang mga numero. Yanura, tibok pondo sa probinsya kapin 2.5 billion. Para sa panglawas, 557 milyones. Ikatulo sa pinakadakong bahin sa tanan. Para sa sweldo sa mga trabahante. 760 milyones para sa operasyon sa opisina. Halos 49% katunga sa tibok pondo. Kung dako kaayo ang pondo sa panglawas, nga 557 milyon. Kung dako kaayo ang pondo sa sweldo nga 760 milyon. Ngano kusara ang doktor?
budget para sa tuig 2026 sa katidad ng kapin 2.5 billion pesos kay natunga sa upat ka expense class. 49.41% sa budget kay gitagana para sa maintenance and other operating expenses o MOOE. 30.40% pod niini kay para sa personal services, 18% para sa capital outlay ug 2.19% para sa loan amortization. Nabahin po ng expenditure program sumala sa sektor. Nakaangkon og pinakadako nga bahin ang economic services sector nga adunay 27.64% o kapin 692 million pesos nga bahin. Diin naglangkob niini ang critical areas sama sa infrastructure, agriculture, environment, investment, and tourism. Nisunod ang general public services sector nga nakaangkon og bahin nga 27.50% o kapin 688 million pesos. Ug ang ikatulo kay ang health services nga mikabatok 557 million pesos o 22.27%. Sa
We have 42 regular employees, 1 doctor, 2 dentists, 13 contract of service, and 40 job orders. We have 42 regular employees, 1 doctor, 2 dentists, 13 contract of service, and 40 job orders. We have 42 regular employees, 1 doctor, 2 dentists, 13 contract of service, and 40 job orders.
nga niagi og nisubay sa taas, kuti husto og legal nga proseso sa pagprepara og paghanay sa annual budget. Ang annual budget para sa tuig 2026 sa katidad ng kapin 2.5 billion pesos kay natunga sa upat ka expense class. 49.41% sa budget kay gitagana para sa maintenance and other operating expenses o MOOE. 30.40% pod niini kay para sa personal services, 18% para sa capital outlay ug 2.19% para sa loan amortization. Nabahin po ng expenditure program sumala sa sektor. Nakaangkon og pinakadako nga bahin ang economic services sector nga adunay 27.64% o kapin 692 million pesos nga bahin. Diin naglangkob niini ang critical areas sama sa infrastructure, agriculture, environment, investment, and tourism. Nisunod ang general public services sector nga nakaangkon og bahin nga 27.50% o kapin 688 million pesos. Ug ang ikatulo kay ang health services nga mikabatok 557 million pesos o 22.27%. Sa
We have 42 regular employees, 1 doctor, 2 dentists, 13 contract of service, and 40 job orders. We have 42 regular employees, 1 doctor, 2 dentists, 13 contract of service, and 40 job orders. We have 42 regular employees, 1 doctor, 2 dentists, 13 contract of service, and 40 job orders.